Welcome back to the channel. I'm Dr. P, and today we are continuing with our review of beta and alpha receptors. These receptors are highly relevant to clinical medicine and are associated with some of the most common medications you'll see patients taking. The three most common beta adrenoceptor subtypes are beta 1, 2, and 3. Beta 1 is found in the heart. Activation of this receptor leads to faster heart rate, chronotropy, enhances myocardial contractility, inotropy, and increases conduction through the atrioventricular node, dromotropy. Chronotropy is achieved by increasing the rate of diastolic depolarization. This occurs most at the sinoatrial node, where there is a huge concentration of beta 1 receptors. Inotropy is achieved by beta 1 activation in ventricular myocytes, leading to phosphorylation of L-type calcium channels, phospholin band, and troponin I. By knowing the formula, cardiac output equals heart rate times stroke volume, you can relate all hemodynamics back to cardiac output and systemic vascular resistance. Moving on to beta 2 receptors, these are located in smooth muscle of the airways, blood vessels, and in the uterus. Activation of these receptors leads to smooth muscle relaxation, leading to bronchodilation, vasodilation, and uterine relaxation. Lastly, beta 3 receptors are most common in adipose tissue and in the GI tract. Activation of these receptors promotes breakdown of fats via lipolysis, while in the GI tract it leads to GI smooth muscle relaxation. Now a question for you. Can you name a drug targeting each receptor? We will go into details of beta drugs and their selectivity in the last part of this chain series in Internal Medicine 5, the beta drugs. Thank you for joining me today as we explored the world of beta and alpha receptors in clinical medicine.